With illegal immigration hitting peaks not seen in over a decade, thousands of migrants are arriving in the U.S. infected with highly contagious diseases. That's according to One America's Pearson Sharp.
The measles epidemic in the United States is hitting record highs not seen in a quarter of a century. According to the CDC, there are over 700 cases of measles in 2019, the highest number since 1994. But perhaps unknown to many, the United States had actually declared measles officially eliminated as of the year 2000. So now, 19 years later, what's changed? Where is this outbreak coming from? For many, that answer is simple: south of the border.
They're seeing crossers with contagious infections, and sources tell me right now, all that's separating the sick from the healthy, this caution tape, and agents tell me that's not enough.
The United States is currently under invasion from hordes of illegal aliens from all over the world, pouring over the southern border. The onslaught is at its highest levels in over a decade, bringing with it rampant crime, drugs, and yes, diseases. Just last month, there were over 2,200 people quarantined over a mumps outbreak in detention centers for illegal immigrants. Hundreds of detainees were confirmed to be infected with the disease around the country, a disease which was once nearly eradicated from the United States.
We're starting to see chickenpox, we're starting to see staph infections, we're starting to see different viruses.
According to Border Patrol agents, more and more migrants from Central and South America are arriving with diseases like the flu, cankerous sores, sexually transmitted diseases, and even deadly flesh-eating bacteria. Usually, immigrants and refugees are required to undergo medical screenings and exams. However, there's simply no way to enforce this with illegal aliens, who arrive by the thousands and without warning, overwhelming the small number of Border Patrol agents who are already stretched thin. Testing these migrants presents a problem as well. Border agents now spend nearly half of all their time on duty simply taking migrants to hospitals, which leaves the border wide open for illegal aliens to cross. One of the first major migrant caravans to arrive in November brought with it thousands of cases of chickenpox, skin infections, tuberculosis, and even HIV and AIDS. Combined with a disastrous catch-and-release policy, it's not hard to see how diseases that were once wiped out in the U.S. are now making a major comeback.
I'm very concerned about the resurgence we've seen of vaccine-preventable illness, and I think many of us have heard about the outbreak of measles in Southern California, and I know that there are many parents and community members who are concerned now about not just measles, but about other illnesses which may be preventable, but which we may be at risk for because people aren't getting immunized the way they used to.
In 2016, there were 22 confirmed cases of measles in an Arizona detention center for illegal aliens. Now, 3 years later, as illegal immigration soars, diseases like measles are skyrocketing. In places like California, a sanctuary state where it's illegal to deport illegals, over 650 students and staff at universities in Los Angeles are now being quarantined amid a fresh measles outbreak. Health officials say at least 38 people in California have been infected with the disease this year, one of the most contagious in the world. Just a single person with measles can quickly spread the sickness to thousands of people. Outbreaks of measles have been reported in 22 states so far, with the heaviest cases being reported in California, Michigan, New York, New Jersey, and Washington. All states with some of the highest populations of illegal aliens. Even the far-left Democratic mayor of New York City agrees these disease-ridden illegals are becoming a major problem.
Some have lice, some have bed bugs, chicken pox, all sorts of contagious situations. And, just think of the chaos of all this.
As the numbers of illegals grow exponentially from the thousands to the hundreds of thousands, so too do the risks for deadly infectious outbreaks. And like migrant crime, none of these diseases would ever threaten American citizens if these illegal aliens weren't here in the first place. Pearson Sharp, One American News.
Want to see more videos like this? Click on the link below and subscribe to One American News on YouTube, and call your cable provider and kindly demand that One American News is added to your lineup. Call and subscribe today.